Good morning, ladies and gentlemen. 4th of February is a World Cancer Day. World Cancer Day is being observed as an initiative of the Union for International Cancer Control. Cancer is a major public health problem today. It is the second leading cause of death after cardiovascular diseases, and approximately 18% of the deaths which occurred worldwide in 2020 were due to cancers, which basically means that 1 in every 6 death is due to cancer. In 2020, total of 10 million people died of cancers across the globe, and around 20 million new cases of cancer were diagnosed. It is time to act now to create a world without cancer. 30 to 50% of cancers are actually preventable. Beyond prevention, early diagnosis through appropriate screening and effective treatment options can help in reducing the mortality due to cancer. In terms of effective treatment options, during the past few years, there have been approval of various monoclonal antibodies and immune checkpoint inhibitors, which have shown significant improvement in terms of overall survival as well as progression-free survival for cancer patients. The biggest challenge today in the treatment of cancer is in terms of access and affordability. Apart from access and affordability, which is primarily due to the cost issues, other challenges are income, education, location, and discrimination based on age, gender, sexual orientation, lifestyle, disability, etc. All these factors negatively affect the cancer care. Amid all this, there is positive news from the United States of America. During the last 3 decades, there has been a 30% decline in the mortality due to cancer, and the rate of decline is actually increasing. In 1990s, this decline was at the rate of 1% per year, but between 2015 and 2019, this has been at the rate of 2% per year. This gives us a ray of hope that tomorrow there can be a world without cancer. Today, we have to overcome inequity in cancer care, and there is a need to invest more in terms of drug development to develop treatment options which can significantly benefit the cancer patients, not just in terms of survival, but also in terms of improving their quality of life. Many of these treatment options are very costly, and for cancer drugs, the annual cost of therapy, particularly with the biologics, can be as high as $200,000 per year in the United States. Therefore, generic drugs and the biosimilars have an important role to play. Today, on the World Cancer Day, this video is intended to raise awareness about cancer. Now, let us look at data about new cancer cases as well as cancer deaths in the year 2020. This is based on Globocan 2020 and the data provided by International Agency for Research on Cancer. First of all, let us look at number of new cases in various continents in 2020. Approximately 49% of all new cancer cases were diagnosed in Asia, followed by 23% in Europe and 13% in North America, while less than 6% of cases were reported from Africa. Now, if we compare this with the actual population of these continents, what we see here is that the diagnosed cases are more than double in Europe, given that Europe has less than 10% of the world population residing. Similarly, if we look at North America, it is almost double. North America has 8% of world population and 13% of cancer cases were reported from North America. The biggest problem here is in countries like Africa, where 18% of the world population resides, but less than 6% of the cases were actually reported from Africa. So this does not necessarily mean that the actual incidence of cancer is higher in the Western countries. This may actually have to do with the lower diagnosis rate, which is resulting in many cases remaining undiagnosed. Similarly, if we look at the number of deaths which happened in 2020 due to cancer across various continents, what we see here is that the maximum number of deaths happened in Asia. Almost 60% of the deaths happened in Asia. And when we look at North America, 7% of deaths happened in North America. Again, we see that in Europe, 20% of deaths, 20% of the cancer deaths were in Europe, which is again double of the population of the Europe. On the other hand, in Africa, it was almost 7% of all the worldwide deaths of cancer, they were reported from Africa, which again shows that many of the cancer deaths remain undetected in continents like Africa. Now, the question is, what is the economic impact of cancer? So, if we look at the impact of cancer in terms of the cost of cancer care and the negative impact it has on the productivity, it appears that in 2020, the cost of the cancer care was $1.16 trillion. So this includes not only the actual cost in treating the cancer patient, but the loss of productivity due to cancer. Now, what about the future of cancer? The number of new cancer cases diagnosed every year are likely to increase to 29 million in 2040, compared to 19 million in 2020. Basically, there is going to be a 50% increase. Similarly, number of cancer deaths occurring annually are likely to increase to 16 million in 2040, compared to 10 million cancer deaths which happened worldwide in 2020, almost a 60% increase. One of the highest increase, both in terms of incidence and mortality, both in terms of males and females, is expected to occur in the continents of Africa, Latin America, and Asia. Also, an important thing to note here is that except for Africa, in all other continents, both the incidence and mortality due to cancer is higher in males compared to females. Now, regarding the types of cancers, in terms of new cases in 2020, the most common cancers were breast cancer and lung cancer. These were followed by colorectal cancer, cancer prostate, stomach cancer, liver cancer, and cancer of uterus cervix. If we look at the cancer deaths, the leading cause is again lung cancer. It is followed by colorectal cancer. Now, even if the breast cancer is one of the most common cause of cancer, in terms of number of deaths, there are other cancers like the liver and stomach cancer, which cause more deaths compared to breast cancer. This is because in these cases, the diagnosis is quite late and we do not have that effective treatment options as we have for breast cancer. Apart from these, other gastrointestinal cancers like that of esophagus and pancreas are also some of the leading causes of cancer deaths across the globe. Let us look at the data regarding which is the leading cancer in terms of new cases in various countries of the world. Now, this varies based on the gender. So, for example, among males, in 117 countries of the world, prostate cancer is the most common cancer. These include majority of the North American, South American, and African countries, as well as Australia and New Zealand. Now, lung cancer is the most common cancer among males in around 40 countries of the world. These include many of the European countries and Asian countries, including Russia, CIS, China, etc. Now, in the Indian subcontinent, in India, Sri Lanka, Pakistan, it is the lip and oral cavity cancer, which is the most common type of cancer. Now, what about females? Now, in case of females, in 159 countries of the world, perhaps almost all continents of the world, breast cancer is the most common cancer. And there are around 23 countries of the world, mostly African countries, where cervix uteri cancer is the most common cancer among females. Now, let us look at some of the data from the United States of America. During the past 5 decades, what has happened to the cancer incidence? There are 2 factors which have led to a change in the cancer incidence during the last 5 decades in United States of America. First, a change in the behaviors associated with cancer risk. For example, smoking. And the second is the changes in the medical practice, such as the use of the cancer screening test. For example, there was a spike in incidence for males for prostate cancer during the early 1990s because many of the asymptomatic prostate cancer cases were being diagnosed because of the rapid uptake of the prostate-specific antigen testing among previously unscreened men. Overall, cancer incidence in men has decreased from early 1990s until around 2013 and then stabilized through 2018. Whereas in women, the rate has been fairly stable through the mid-2010s, but has picked up slightly in recent years. Consequently, the sex gap is now narrowing. Now, looking at the mortality data over the last few decades in the United States, there has been a 32% drop in the cancer deaths compared to 1991. This success is largely because of fewer people smoking, which has resulted in decline in lung cancer, as well as smoking-related cancers. But apart from prevention, there has been a role of early diagnosis there has been a role of screening, and there has been a role of advancement in the treatment options. Particularly, chemotherapy after surgery for breast cancer and colon cancer have increased the chances of survival. There is now combination treatment option available for many of the cancers, which have increased the overall survival rate compared to monotherapy. And early detection has helped in diagnosis of cancer at early stage. For example, the breast cancer, the cervix cancer, the colon cancer, the cancer of prostate and rectum. And more recently, even the lung cancer is getting diagnosed early. And if we diagnose the cancer early, there is high likelihood that the patient can be managed and there would be higher chances of survival. There is some more data about. Now let us look at some more data from the United States, which shows that early diagnosis can help in improving the survival of cancer patients. In almost all types of cancers, the 5-year survival rate is much higher when the cancer is diagnosed at early stage, when it is localized. For example, in breast cancer, melanoma of skin, and prostate cancer, the 5-year survival rate for localized cancers is more than 99%. But if the same cancer gets diagnosed later, at a stage when the distant metastasis has already taken place, the 5-year survival rate decreases to 20 to 30%. Similarly, in the case of gastrointestinal cancers, like that of liver, biliary tract, pancreas, and esophagus, if the diagnosis is done early, the 5-year survival rate is still better, even though in these cancers, even getting diagnosed early, the 5-year survival rate is just 30 to 50%. But if the diagnosis is delayed, when distant metastasis has already taken place, in these cancers, the 5-year survival rate is less than 5%. For early diagnosis, various screening tests, as well as a high degree of alertness, both on the part of physician as well as patient and his family members, are important. Now that brings us to the most important question. What can we do to prevent cancer? Now, diet plays an important role. A healthy diet, a high fiber diet, a diet with optimal caloric intake, and a vegetarian diet may help reduce the risk of certain types of cancers, like the colorectal cancer and the post-menopausal breast cancer. Over a dozen types of cancers are more common in obese, and hence optimal body mass index through dietary control as well as regular physical activity can help in reducing the risk of cancers. Similarly, alcohol consumption is known to be associated with almost half a dozen types of cancers. Cigarette smoking is known to be associated with over a dozen types of cancers. Sunbeds, they increase the risk of melanoma and certain other types of skin cancer. From a prevention perspective, if we reduce smoking, reduce alcohol intake, reduce caloric intake, increase the physical activity, there is a possibility to cut down the risk of some of the cancers. Apart from this, for cancer of uterine cervix, there is a vaccine, the HPV vaccine, which is now available, which has been shown to reduce the risk of this cancer. Pesticides, dyes, and other chemicals also increase the risk of certain types of cancers, and therefore, we need to be cautious and make sure that we do not come in contact with such kind of chemicals which increase the risk of cancer. Together, we can overcome the challenge of cancer, and we can work towards a world where nobody dies of cancer.